as we've been talking about, there are way too many people diagnosed with cancer these days, but the good news is that we have way, way more survivors than we've ever had. And we have a lot of breast cancer survivors out there, and these women, unfortunately, do face some particular problems when it comes to menopausal issues. And I'd like to spend a few minutes talking about the issues that these women face. Just like all other women, they can face problems related to hot flashes, night sweats, insomnia, related to menopause. They can also be dealing with vaginal dryness. These are very, very common problems, and they pose particular issues for breast cancer survivors. And I'd like to spend a few minutes talking about that. So why are these issues peculiar for women with a diagnosis of breast cancer? Well, indeed, one of the mainstays of therapy for both hot flashes and vaginal symptoms have been estrogenic substances. And indeed, there are some questions about using estrogens in many women who are breast cancer survivors, particularly those who have dealt with an estrogen receptor positive tumor. So what we need to do are talk about alternatives to treat the problems that they face. So let's start talking about hot flashes. So if a woman has had estrogen receptor positive breast cancer, indeed, most oncologists do not want to treat her for hot flashes and other vasomotor symptoms with estrogen. The good news is we have a lot of other options available for these women. For example, in Germany, in German breast cancer centers, one of the most widely used substances there for hot flash therapy is black cohosh, particularly the brand Remifemin, which is made in Germany and you can get imported over here, has very good efficacy for hot flashes, night sweats, things of that nature. For women, it is non-estrogenic, so there is no estrogen in the product. This is a specifically different herb that's out there and is readily available. So again, always I would recommend that all women who are dealing with this talk with their healthcare providers, talk to their oncologist, talk to their gynecologist before instituting any therapy. But indeed, Remifemin, hot black cohosh is quite reasonable for breast cancer survivors to use. One of the more controversial issues in over-the-counter therapy is indeed in the use of soy and soy supplements for hot flash relief in breast cancer survivors. So why the controversy? Well, the controversy is because soy basically helps to relieve hot flashes. It is felt because it contains a weak plant estrogen called an isoflavone. And the question is, can these isoflavones act in a negative way towards women who have an estrogen receptor positive breast cancer diagnosis? And that's been a question that's been asked for many, many years. And there are two schools of thought on that. Many people say, nope, she can't use soy because it is a weak plant estrogen. However, many experts believe that the isoflavones in soy actually act more like tamoxifen because they do bind to the estrogen receptor in cells, as tamoxifen does, but they act like tamoxifen as a blocker of even stronger estrogens. So indeed, and what those folks tend to point to is a block of data, for example, that shows that the country that happens to have the lowest breast cancer incidence in the world is Japan, and it also has the highest soy incidence, soy use incidence. So how bad could the stuff be is sort of the school of thought that's introduced there. And again, the explanation is that maybe it acts like tamoxifen. So what I would, again, before you start using a lot of soy as a breast cancer survivor or a soy supplement, I would talk to your oncologist, talk to your gynecologist, but indeed it is something that some folks certainly can consider. Okay? So let's say, though, you're somebody who's perhaps tried soy, perhaps tried black cohosh, and you're still symptomatic. You're still suffering with hot flashes, night sweats, things of that nature. What else can a woman use besides estrogen? The good news is we do have other options. And the two mainstays of prescription therapy for these women would be an SSRI or SNRI antidepressants, which have been shown about 20 years ago to be effective for hot flashes in menopausal women, and quite safe options for women to use. The good news about SSRIs is that we can actually use fairly low doses that are far lower than doses we use as an antidepressant, for example, which can be quite effective for hot flash relief. So this is something you might want to consider. And again, talk to your oncologist, talk to your gynecologist. Now, there are certain concerns with certain varieties and medication interactions. So obviously you want to talk to your oncologist and gynecologist, but there certainly are several drugs in that category which might be effective for you. The concern we have about SSRIs in all people is perhaps issues of weight gain and issues of decreased libido, but in general, with the very small doses that we need to use for women in drugs in this category, it's in general not a problem. So again, something to consider. The other category of medication that we can use is the drug gabapentin, which is a neurological drug marketed as Neurontin. It's been used now for about a dozen years for the treatment of vasomotor symptoms, hot flashes, night sweats, insomnia in menopausal women with reasonable success. A couple of things about the use of Neurontin is to remember that its side effects include sedation and in some women bloating. So again, we tend to start with as low a dose as we can. We also give it at night because we hope it will induce some somnolence at nighttime so we can get better sleep for folks, which is what we're hoping to do. And again, we start with a low dose and work up to get to a level that will be helpful without giving side effects. Just remember there are interventions that we can safely use for women with hot flashes. Don't just suffer. Talk to your healthcare provider and see what options she or he might suggest for you to try. Now let's talk about vaginal dryness, because that is a very common problem that women experience postmenopausally. And indeed, it's a significant issue for breast cancer survivors. Well, let's talk about the easy remedies first. Over-the-counter therapy is absolutely safe for a breast cancer survivor, and indeed that the therapy that can be used, there are two kinds. There are lubricants and there are moisturizers. These are available over-the-counter in any pharmacy, and that there are many different varieties of lubricants. These are medications, they're substances, not really prescription medications, that can be used at the time of intercourse to make things more comfortable. There are many different brands, and what I always encourage my patients to do when buying one is just buy a small amount of the first time when you try anything to make sure it agrees with your tissue. And then you can get the big variety economy pack. But the key thing is start with small amounts to make sure you tolerate it okay. The next category that one can use are moisturizers. And indeed, a moisturizer is available over the counter, but they are longer acting than a lubricant. And this is something you would place in your vagina 2-3 times a week with an applicator, and they usually come packaged as such, and that will provide longer lasting relief in the vagina. Now, many women who use a moisturizer will also feel comfortable using a lubricant at the time of sex, and that's fine. The most common brand that we see used in this country is Replens, which offers a lot of women good success, and it's something you should consider if you're suffering from vaginal dryness. Another non-pharmacological intervention are things like vibrators, and vibrators are really quite good because they can help recruit pelvic blood flow. And I'm sure many of you have heard that old expression, use it or lose it. And indeed, sexual activity helps to restore pelvic blood flow. Vibrators can be helpful. All these things can be helpful. And the more activity you have, the more moisture you probably will have. But let's say these over-the-counter non-medical interventions haven't helped you. What else can we do? Well, the next topic is a bit controversial, and I'm going to talk about this, but you need to talk about this to your oncologist and to your gynecologist. And that is the use of vaginal estrogens. Vaginal estrogens are very different than what we call systemic estrogens, pills, patches, things like that. And the reason it's a very different topic is the amount of estrogen that gets absorbed into the bloodstream is minuscule. I mean, we've actually had studies done which show really very minimal absorption into the bloodstream. So the question is, can these small amounts be detrimental? And the answer is, unfortunately, we don't have a lot of studies, a lot of data to show as far as long-term follow-up. What we certainly can say is the amount that's absorbed is very small. Now, particularly in women who are taking something like tamoxifen, which actually acts as a shield against estrogen wandering in the body. So you may say, well, if somebody does absorb a little bit of estrogen from the vagina, but she's on tamoxifen, it's just going to bounce off of the receptor tissue in the breast because she's got that shield up. Many people do feel that way and feel comfortable with their patients using vaginal estrogens. Some folks do not. So again, this is something you need to discuss with your gynecologist and your oncologist to come to a satisfactory resolution for you, but it is certainly something that many folks do use with good success. There are also some controversies out there. There is a new medication, which is an oral medication, which actually is a cousin of tamoxifen. It's not an estrogen. And some folks are talking about using that for breast cancer patients. The problem is they haven't done trials in breast cancer survivors. So I, for one, am hoping that these trials will be done because from a theoretical perspective, it certainly sounds like something that might well be a helpful thing for our breast cancer survivors to be able to consider. So I would say on that one, stay tuned. So the good news is that there are many things that we can do to help breast cancer survivors. They do not have to put up with issues of hot flashes and vaginal dryness and just suffer. There's a lot of stuff that we can do. Do check in with your oncologist. Do check in with your gynecologist to come up with a solution to help you. The vast majority of women who are diagnosed with breast cancer indeed do not have a strong family history, nor are they positive for the BRCA gene. Indeed, only about 10% of women who are diagnosed with breast cancer are on a genetic basis. But this group of women constitutes a very special group of patients. This has been brought to our attention particularly recently by the actress Angelina Jolie and her courageous public campaigns to educate women about this diagnosis, for which I really applaud her. So let's talk a little bit about women who are diagnosed as carrying the BRCA gene. First of all, one thing that I would strongly encourage women to do is not to panic. Although yes, there is an increased risk of being diagnosed with both breast and ovarian cancer in these women, it is not usually at a very young age. And indeed, it is safe for these women to have children, and to basically go to their 30s without any significant surgical interventions. We do in general recommend that a woman, who is and her very young person is not ready to have children, if she happens to carry that diagnosis, be placed on birth control pills to help prevent ovarian cancer. Birth control pills, by the way, are a very effective way of minimizing the risk of ovarian cancer and a very good actual method of what we call chemo intervention or chemo prevention, that this is a good way to help prevent ovarian cancer. But let's say you've reached that age, that you're done with your childbearing and you're ready to have surgery to take out your ovaries, which is indeed something that's quite reasonable to do in somebody that carries the BRCA diagnosis. What do you do for these women as far as hormone therapy? Because indeed, if you have a very young woman, a woman in her 30s is a very young woman, and you take out her ovaries, all of a sudden she's going to be put into menopause. And for many of these women, they would have very devastating hot flashes, night sweats, and insomnia, and other very significant symptoms if we did not give them estrogen therapy. What is also true about these very young women, if we deprive them of ovarian function and don't give them estrogen, is that they are a very significant increased risk for heart disease, osteoporosis, and dementia, which are pretty devastating diagnoses. So in general, if we have one of these very young women, we do recommend giving her estrogen therapy, basically until she reaches the age at which natural menopause might be occurring. They do require close follow-up, of course, but that hormone therapy is recommended. When Angelina Jolie underwent her surgery, that is indeed what path she followed, according to her own statements, and it sounds like a very reasonable way to have that handled. So indeed, if you are diagnosed with BRCA, you definitely want to be followed carefully by an oncologist, by a gynecologist, but with good, careful management, you should do quite well. I'd like to spend a few minutes talking about an approach to women who have vaginal scarring, either just from dryness related to menopause, or particularly for women who've had radiation therapy to the pelvis, such as women who've had radiation for cervical cancer, colon cancer, things of that nature. And indeed, many of these women will suffer from strictures and narrowing of the vagina. The good news is that we can really help all that. And indeed, what I'm sitting next to here are a bunch of what we call vaginal dilators. And these are soft, graduated, cylindrical tubes, basically, which can be placed in the vagina. And if somebody's got a very narrowed vagina, very scarred vagina, we'll start with a very, very small one, have her place it in the vagina. This is something that she can place herself, guide into the vagina. Her partner can help her if she wants. And we encourage women to use the largest size in which they're comfortable, and that they place it in the vagina and try to keep it there for a few minutes, 5 minutes, 10 minutes, however much she feels comfortable. If she can even do it a couple of times a day, that's great. I mean, the more she can do it, the better. And to have her just leave it in the vagina for a few minutes and let it just gently set there and stretch it. If she's watching TV before she goes to bed, she can apply it then. But any time that she uses it will be helpful to help stretch the vagina. And what we do is we have her start with the smallest size and then gradually increase to get the tissue stretched so that she can accommodate a normal size penis for intercourse. So this is indeed what we work with. There are many different brands of dilators available. This type of dilator is available from Soul Source on the web or Metamor. There are plenty of other dilator sources available on the web, and that these are very helpful devices to help women to avoid or to basically take as therapy for vaginal scarring. Again, what we do for women who can use vaginal estrogen, I will actually have women coat this with a vaginal estrogen cream before she places it in the vagina, because that will carefully disperse the vaginal estrogen cream right up to the vagina and help soften that tissue. If she cannot use vaginal estrogen creams for one reason or another, that she can certainly use a lubricant, something like Astroglide or KY, to help glide these inside and let them do their stretching. So again, an approach to a problem. It is a mechanical approach. It's been around forever. These devices have been available for hundreds of years and can be very effective as far as stretching the vagina.